My name is Nandini Menon. I have been in the teaching field for almost 11 years. During this period, I've had the opportunity to observe, learn, and enrich my experience being with children from a very tender age. I have been working with preschool, kindergarten, and even the older after school care children. I have gained experience by working as a teacher, a branch coordinator, then an academic quality manager as well for a branch of schools in Cochin. So, being in close proximity with little kids, I have come across various problems associated with learning and behavior. I personally feel that every teacher should be aware of all these factors to make the teaching and learning process more effective and to create a happier, healthier, and productive classroom atmosphere for our children. Therefore, I am here to discuss a very important topic, and that is learning difficulties, their assessment and intervention. Now, since I've been a teacher, I have been noticing children, observing them, and seeing that learning process and the way they absorb things and understand is not uniform. Different children take in information in different ways, and finally, in order to know what are the basic difficulties that children find during the learning process, we actually have to find out what exactly is learning. What do we mean by learning? Well, learning, it is a process of acquiring new understanding, knowledge, behaviors, skills, attitudes, and preferences. It is a process that leads to change, which occurs as a result of experience and increases the potential for improved performance and future learning. Now, we have often seen that when we were kids, we would learn how to ride a bike, do long division, or perhaps learn the capitals of countries, or even learn how to do laundry or drive a car when we were a bit older. Now, how do we do this? This is what we observe and we see around us, and naturally we learn those things, and practically seeing, we are learning every single day of our lives. Now, different meanings have been put forward for the term learning. However, in the field of educational psychology, learning is a specific term. So, in general, learning is a step by step process in which an individual experiences permanent, lasting changes in knowledge, behaviors, or ways of processing the world. Now, basically, in educational psychology, it has been put forward that we learn by some particular methods. Now, let's just go a little bit into how we actually learn. The first method is the learning by observation. Generally speaking, we learn a lot by observation right from infancy. We learn not only from our own experiences but also by observing those around us, the way they behave and the consequences of that particular behavior. For instance, we all learn to speak simply by observing and listening to people around us. A child learns to walk, to run, to jump by seeing others doing the same. At times, observational learning is so natural that we do not really feel that it is happening to us. Then we have learning through the cognitive method. Now, what exactly is this? Well, active and constructive thought processes such as practice or using our own memory, such as we might have been taught to tell the time by looking at the clock. Someone might have been taught about the small and the big needle and might have had to practice telling time when we were first learning it. In this process, some learning was entirely inside your mind and didn't involve any physical emotions or behaviors. It was all cognitive, meaning an internal thought process. Now, we also have learning happening through the conditioning method. Now, what exactly is conditioning? Well, there are two types of learning by conditioning, which is by classical conditioning as well as operant conditioning. So let's just look at what exactly these two are. Now, in classical conditioning, we learn to associate a particular thing in our environment with a prediction of what will actually happen next. Now, for example, we have a research by the Russian scientist Pavlov, who taught his dogs that every time he rang the bell, they would be served food. Eventually, the dogs would begin to drool every time they heard the bell. So, it is a reaction to an environmental cue that tells us what is going to happen next. Then we have the operant conditioning. Here we learn that a particular behavior is usually followed by a reinforcement or a punishment. For instance, if we see in a family, after dinner, if a child clears the table and washes the dishes, the mother gives a hug and thanks her for helping her. In this particular situation, the mom's response is a positive reinforcement. If it makes you more likely to repeat the operant response, which is to clear the table and wash the dishes. Now, so depending on the experiences, what we observe, what conditioning happens in us, and what cognitive learning is possible through us, we basically learn through all these methods. Now, this learners can be of different types. Some people are more prone to learning through visual objects, some through the oral, some through the kinesthetic, and some through reading and writing. Right? So, visual, we have people can understand better through pictures, diagrams, illustrations, and for those by oral, they get to learn or absorb faster when they listen to the lectures, recordings, rhymes, songs, or and so on. So similarly, kinesthetic is through experience, observation, activity, and actual experimentation. And reading and writing, people learn through reading material and writing summations. So this is particularly how learning takes place and the different types of learners. Now, once we are aware of this, once the teacher knows this, she will be definitely able to understand if a child has a particular learning difficulty when there is a difficulty in this. Okay, so now let us get into our topic, that is learning disability. Now, learning disability or learning disorder is diagnosed when an individual's achievement on individually administered standardized test in writing, math, or written expression is substantially below that expected for each schooling and level of intelligence. Problems significantly interfere with academic achievements. Now, we can just go a little bit into the deep into finding out what exactly we mean by learning difficulty, and the common terms used to express learning. This particular term can also be learning differences, learning disorders, learning disabilities, and so on. Now, just let us just go through the points to just know what exactly learning difficulty means. Learning difficulty can be described as issues with the brain's ability to process information. Individuals who have a learning difficulty may not learn in the same way or as quickly as their peers, and they might find certain aspects of learning, such as the development of basic skills, to be challenging. As learning difficulties cannot be cured, their effects may impact an individual's performance throughout life, academically, in the workplace, and also relationships in daily life. Now, kids with learning disability do not make adequate progress and keep up with their peers academically. They may show a scatter in the standardized test scores, however, have average or above average IQ levels. Learning difficulties, which are neurological challenges, affect the way the brain receives, processes, stores, and analyzes information. It often affects an individual's ability to develop reading, writing, and math skills. A learning disability is typically recognized and diagnosed while an individual is in school. However, for some, it is not diagnosed or discovered till much later in life and may continue to experience difficulty processing information as they progress through life. Learning difficulty indicates an individual's need for alternative learning methods. They are not indicative of intelligence level and are not as same as intellectual difficulties, learning challenges that result from sensory handicaps, developmental delays, or cultural, economic, or environmental disadvantages. While some are mild, others may have a severe impact on the individual's academic performances. Behavioral teachings tailored specifically to the type of difficulty can help an individual to develop strategies to address and work with a particular challenge, and intervention can be significant benefit. Simply having a learning difficulty does not mean an individual will be able to succeed academically or hold an intellectually demanding position in society. Learning disorders are neurologically based processing problems identified via psychological educational testing, and it affects a large population of public schools. The outcome can be improved with specific interventions. However, LD can exist in isolation as well as in combination. Now, since we are now aware of what exactly learning disability is, we can just go a little more into the facts, some more facts of the learning disabilities. Okay, probably persons with learning disabilities are not lazy or dumb. In fact, they usually have an average or above average intelligence. Attention disorders such as hyperactivity, attention deficits, learning disabilities often occur at the same time, but they are not the same. So, learning disabilities are caused by a lack of educational opportunities such as frequent changes of schools, poor school attendance, or lack of instruction in basic skills. So basically, if we just go through this, these are the basic features of learning disabilities which most of the children experience, and if they are administered at the appropriate time, we can help them perform in life in a much more stable and better manner. Emotional issues are also a part of children with learning disabilities. Often we see students with learning disabilities may suffer from emotional problems, depression, and or low self-esteem. This may cause students to withdraw from social interaction. These same students may turn to drugs or alcohol for relief from feelings of low self-worth. As many as 35% of students with learning disorders drop out of high school. Teenagers with dyslexia are more likely to think about and to attempt suicide than other young people of their age. Now, here are some statistics about learning disabilities as defined in the following years. So now, in short, and to be more specific, signs of learning disabilities can be as follows. They have very slow reading rate, problems remembering math facts, difficulty finding important points or main ideas, difficulty recalling arithmetic operations, problems understanding what is read, problems with reasoning and abstract concepts. Confusion of similar words, frequent spelling errors, poor organization and management of time, difficulties beginning and sticking with study, letter reversals, poor note taking and outlining skills, confusion of similar words, difficulty remembering what is read. Further, there is an inability to complete assignments on time, difficulty with sentence structure or poor grammar, difficulty following directions, slow writing rate, poor memory for recalling material, overly large handwriting, and so on. So generally accepted estimates of prevalence in school age children range from 3% to 9%, but may run as high as 20 to 25%. Among children with reading disability, classroom teachers have reported a relatively high prevalence of signs of vision disorders, including facial grimacing, squinting, head tilting, eye rubbing, and unusually close working distance. If a level of reading success is not achieved, the quality of life for the individual as well as the society as a whole is diminished. Further, now let us get into more specific the other characteristics of LDs. Now, we often see that children who are suffering from learning disorders have poor motor abilities and find it difficult to do a lot of motor activities like holding a pen and so on. Social skill deficits are seen. They may keep themselves aloof, may not be able to mingle and socialize with others. There are disorders of attention where they demand attention or they are not able to concentrate or pay attention. They seem diverted, they seem lost, and also suffer from information processing deficit. Children who have a difficulty learning to read fall behind their peers and do not reach their full social and economic potential. Although reading for meaning may be considered a psycholinguistic achievement of multi-component and highly complex behaviors involving many cognitive processes, the initial phase of reading are visual. Now, the most commonly seen types of learning disabilities or disorders can be classified as dyslexia, dysgraphia, and dyscalculia. Now let us see what this implies. Now dyslexia, people with dyslexia usually have trouble making the connections between letters and sounds and with spelling and recognizing words. They often experience some other symptoms which may include a failure to fully understand what others are saying, difficulty organizing written and spoken language, delayed ability to speak, poor self-expression, learning difficulty, new vocabulary, either through reading or hearing, trouble learning foreign languages, slowness in learning songs and rhymes, slow reading as well as giving up on longer reading tasks, difficulty understanding questions and following directions. They may be poor in spelling and also find difficulty recalling numbers in sequence, for example, telephone numbers and addresses. They also have trouble distinguishing left from right. Now, what is the help that we generally can offer a dyslexic child? There are specific programs and methods of teaching that can significantly improve the acquisition of skills. You can find a teacher or tutor trained in an approach like Orton, Gillingham, Linda Mood Bell, phonographics, or any similar systematic multisensory explicit method for teaching the elements of language. They probably even need a lot of appreciation so that their self-esteem is boosted. Now, the various strategies that are employed are to teach the rules of language, which include the sounds paired with symbols, letters, vowel themes, types and rules of syllable, the doubling rule, etc. Begin as soon as possible, but it is never too late to improve skills. Technology can also assist greatly. Now, we can see that here are the 5 most important steps to navigating dyslexia. That is giving them comprehensive support, cognitive remediation, multisensory lessons, in-depth understanding, and thorough screening and assessment. Classroom strategies that can be followed for the same are as pair pair audio books, read loud programs with written text to improve vocabulary and comprehension while building decoding skills. Using printed worksheets, present material in small units, allow oral expression, grade, spelling and writing, mechanics, separately or not at all, visual supports and manipulatives, note frame, offer them a note frame for simple fill-in during class discussion or a classmate or teacher's complete notes. Use of voice recognition software is also used. Use of a laptop or word processor if typing skills are sufficient. As skills improve, decrease accommodations and modifications when possible. Now, help for children with learning disorders like dyslexia to succeed in the classroom. We can usually keep workspaces uncluttered, establish academic routines, use color and 3D in writing exercises, encourage speaking and listening, nurture reading pleasure by presenting easier books. Further, speaking slowly and enunciate clearly. Now, pausing as you give instructions can also help your child process what you're saying. Allow for lag time while your child processes what you have said. Let your words sink in for a few seconds before actually expecting a response or before moving on. Be concise and direct and not attempt long oral explanations. Give simple instructions one step at a time, instructing your child to clean up your room, put on your pajamas and brush your teeth. Now, work in a quiet room with a few distractions as possibly. Listening and processing is hard enough for an APD child. Distractions make it nearly impossible. Work in a quiet room with as few distractions as possible. Listening and processing is hard enough for an APD child. Distractions make it nearly impossible. Optimize concentration and minimize meltdowns by holding lessons during your child's best time of day. Make sure that your child can watch your mouth as you speak. This is especially important if he easily confuses similar sounding words. In APD learners, the ears and brains don't work well together. So watching your mouth will help bring everything into sync. The sound gets crisper when the brain has visual cues to go along with the auditory cues. As much as possible, show rather than tell. Visual demonstrations are much more effective than oral explanation. If your child is struggling to learn a new concept or skill, try to teach the concept with a visual demonstration. Don't overwhelm your child. Children with auditory processing issues can become disruptive or argumentative when they don't understand something. If your child becomes frustrated and you sense a meltdown coming back up in the lesson to a point where your child is more comfortable, try presenting the new information again when your child seems ready to take it. Consistent and constant review encourages success, especially for problematic learners. To ensure steady progress, be sure to include review in your lessons every single day to tackle. Dysgraphia is characterized by problems with writing. This disorder may cause a child to be tense and awkward when holding a pen or a pencil, even to the extent of contorting his or her body. A child with a very poor handwriting that he or she does not outgrow may have dysgraphia. Other signs of this condition may include a strong dislike of writing and or probably drawing, problems with grammar, trouble writing down ideas, a quick loss of energy and interest while writing, trouble writing down thoughts in a logical sequence, saying words out loud while writing, leaving words unfinished or omitting them when writing sentences. Now, if we have to be alert and catch the early signs of dysgraphia, the earliest detectable signs are fine motor issues, lack of interest in coloring and drawing, writing, puzzles, difficulty with scissors, with zippers, late acquisition of skills like when they are using their zippers, buttons, snaps, shoelaces, eating utensils, and so on, and poor sensory feedback. Now, the academic signs that we can be wary of are slow or messy writing, inconsistent letter formation, excessive or poor pressure in writing, frequent failure to erase errors, simply write over other symbols, unusual or awkward pencil grasp, complaints of a sore hand when writing, complaints about the feel of the paper as hand slides over. A further classification of this can be seen in the following diagram, where we can see that organizational skills, keyword vocabulary, benefits from visual support, checklist, requires time to plan visually, story map, mind map, need time for proofreading. That is for classroom management. Probably they would need voice recorder, benefit from assistive technology and methods of recording, requires extra time when writing, may need support with syntax structure and grammar. Activities and instructions need to be broken down. Now for concentration, trouble keeping track of thoughts, tires quickly while writing, and they find difficulty thinking of words to write. Now as far as fine motor skills are concerned, handwriting difficulties, formation, spacing, sizing, manipulation difficulties, using equipment, and pencil grip. Now, the early strategies and early intervention with an occupational therapist to develop fine motor skills. Use of tri-grass pencils and pencil grips, wide line paper, graph paper, slant boards, and so on. Reduce need for writing, enlarge worksheets and leave plenty of space for answers. Specific instruction in keyboard, daily use of computer, voice recognition software. Give copy of notes, teach skills for tracking details, and do not deduct for spelling and punctuation. You have to be a little more lenient, not considering very petty errors, consider grading separately for content and mechanics. Now, dysgraphia is neurologically based and strengths and weaknesses vary greatly from student to student. It is not an issue of not trying hard enough. Repeated practice of writing letters and numbers will not fix the problem because automaticity does not develop. Now, this is something we must keep in mind when we are dealing with dysgraphic kids. Now, help for children with learning disorders such as dysgraphia to succeed in the classroom. We can help them by doing the following exercises: that stretch out your hands, learn to touch type, use cursive versus print, request accommodations, try different paper and pens, make audio recordings, touch type, read and spell. These are a few activities that we can actually help to inculcate and make them feel more comfortable and enjoy their classroom learning. Dyscalculia. This is another form of learning disorder or disability. The signs of this disability include problems understanding basic arithmetic concepts such as fractions, number lines, and positive and negative numbers. The other symptoms may include probably difficulty with math related word problems, trouble making change in cash transactions, messiness inputting math problems on paper, trouble recognizing logical information sequences, and so on, trouble with understanding the time sequence of events, difficulty with verbally describing math processes. Now, dyscalculia in young children, we can see they find trouble recognizing printed numbers, poor memory for numbers, difficulty to learning to count, difficulty connecting numbers to real word application such as 3 bowls, 3 spoons, 3 girls, and so on. Difficulty organizing objects by shape. Dyscalculia is in school can also be observed when we find that they are having difficulty estimating costs, learning math concepts beyond the basic math facts, poor ability to budget or balance a checkbook, then trouble with the concepts of time such as sticking to a schedule or approximating time, trouble with mental math, difficulty finding different approaches to one problem. Trouble learning math facts, that is your addition, subtraction, multiplication, division for instance, difficulty developing math problem solving skills, poor long-term memory or math procedures, difficulty recalling defining math vocabulary, difficulty measuring things, difficulty with counting, estimating, and even comparing. So, dyscalculia, now from this diagram, it can be made a bit more clear that the spatial or temporal difficulties with spatial and temporal, you can see that they find map reading, they find difficulties with telling time, left and right confusion. As far as memory is concerned, they cannot accurately recall number facts, constantly relearning and recapping skills, and organizational issues. As when counting is concerned, they can lose place easily, find counting in 2s, 3s, etc. quite problematic, and difficulty navigating back and forth along a number line or sequence. When calculations are concerned, there is a lack of confidence in their answers, problems transferring information such as, for example, 2 plus 3 is equal to 5. Therefore, 3 plus 2 is equal to 5 is something that is difficult for them to actually understand. Now, when numbers are concerned, they find issues with place values, struggles to understand chronology, and when measures are concerned in the math, they find or rather struggles to understand mathematical concepts, speed, time, etc. Problems handling money, working out, change. Now, for dyscalculia, what are the strategies that can be used? Well, we can use graph paper, find different ways to approach math facts, allow the use of a calculator, practice estimating logical answer, highlight symbols and keywords, work with a tutor or teacher one-to-one to allow extra explanation, practice variation of approach. Introduce new skills with concrete examples, moving to more abstract applications. For vocabulary difficulties, explain ideas and problems and clearly and encourage questions. Offer math charts, questions, offer visual math charts, and even use visuals and manipulatives. Now, since we have discussed about the most important kinds or rather commonly seen forms of learning disorders, now we have some more other processing disorders which can be associated with language, audio, and visual. So let us just go into each and just find out what are the different features of each of these. Now we have the auditory processing difficulties, we have language processing difficulties, and we have the 8 ADHD. Now, what exactly is auditory processing difficulties? That is, you find that children have difficulty hearing noise, difficulty following directions, poor listening skills, academic difficulties, poor auditory association, input disorder, executive function difficulties, mishears words, attention deficits on a secondary level. Now, what do we find in children who have language processing difficulties? We find that they have difficulty getting to the point, difficulty organizing and expressing thoughts, difficulty getting started with open-ended questions, use vague language, difficulty knowing what you say, difficulty reading and responding to social cues, word finding difficulties, difficulty remembering lengthy directions, pronounced differences between performance and verbal abilities. Now, what is ADHD? We find this is quite common in nowadays children. You can find that they are inattentive, easily distracted, hyperactive, very fidgety and restless, hasty and impulsive, terribly interruptive and intrusive, output disorder, blurts out answers, and management includes medicines or rather medication. Related disorders other than this are executive dysfunction, ADHD as we already mentioned, attention deficit hyperactivity disorder, dyspraxia, sensory integration disorder, and further memory disorders. Now, poor executive functions. Now, executive functions we mean are skills involved in higher order thinking, which are cognitive processes of planning, analyzing, evaluating, initiating, monitoring, transitioning, organizing both materials and ideas. Think personal secretary in your brain. That is your executive functions, which you can see they have perhaps the inhibitory control, working memory, and cognitive flexibility. This is what comprises of the executive function. Now, our developmental continuum. Executive functions are a part of a developmental process and do improve with age. Most are in the prefrontal cortex, but also involve communication among other parts of the brain, not fully developed until the age of 25. Now, what is executive dysfunction? Basically, neurological disability involving short-term and working memory organization of materials, time and space, and regulation of attention and focus. When a child's ability to complete tasks appropriate for their age is below expectations, they may have executive dysfunction. There is a consistent inability to keep track of personal items, disorganized binder, locker, desk, messy bedroom, no sense of time, leaving assignments to last minute, difficulty in stating an activity, evaluating progress and navigating to completion. These are the very common seen dysfunctional features. Now, dyspraxia. Now, what is dyspraxia? Now, dyspraxia. Dyspraxia is also a learning disability which is very common among today's children. It is a disorder that is characterized by difficulty in muscle control, which causes problems with movement and coordination, language and speech, and can affect learning. Although not a learning disability exactly, dyspraxia often exists along with dyslexia, dyscalculia, or ADHD. The common symptoms of dyspraxia are poor balance, poor posture and fatigue, poor integration of the two sides of the body, maybe poor hand and eye coordination, lack of rhythm while dancing or doing aerobics, clumsy gait and movement, exaggerated accessory movements such as flapping arms when running, tendency to fall, trip, or rather bump into things and people. Now, how does dyspraxia affect learning? We see that individuals with dyspraxia often have language problems and sometimes a degree of difficulty with thought and perception. Dyspraxia, however, does not affect the person's intelligence, although it can cause learning problems in children. Developmental dyspraxia is an immaturity of the organization of movement. So, since we see that dyspraxia is an important difficulty, which is though not exactly a learning disability, it does affect the learning process. So, the treatment options for dyspraxia are usually what we follow is occupational therapy, which is done by observing the everyday activities of a child in school and at home. Speech and language therapy by assessing the child's speech, and perceptual motor training, which involves improving the child's language, visual, movement, and auditory skills. Now, let us go into the next disorder or other related attention deficit hyperactivity disorder or ADHD. Now, the possible causes may be genetic, environmental factors, nutrition, or even brain injury. ADHD involves the neurological development of the brain cortex and the regulation of natural chemicals in the brain. It can be diagnosed when there is an inability to maintain attention and focus, organize materials, remain on task, transition between tasks, control physicality, wait appropriately, or remember a series of steps or items appropriate for age level. There are further subtypes where we have hyperactive, inattentive, and even in the combined type of features. Now, for the hyperactive, we can see they are characterized by excessive physical activity, fidgeting, inability to settle in an age appropriate manner. Inattentive, where they lose track of activity, conversation, and rather tune out. In the combined type, we can see both hyperactive and inattentive characteristics. Now, how does ADHD affect the brain? Now we can see this is how it actually affects the brain. If you look at this diagram, it gives us a clear indication as to how ADHD affects the brain. Now, further, what are the signs of ADHD? We may observe that these kids interrupt conversations or blurt answers, have difficulty waiting for their turn. Frequently, they do not complete the task given to them. They do not know where the class is and when called on. Frequently, they ask to go to the bathroom. Inability to sit appropriately for age level. High level of physical activity all day. Difficulty falling asleep at night. Quiet and attention fades away. Weak executive functions. Frequently leave assignments incomplete. Difficulty with written expression. So, if we see, basically they are people who find it difficult to actually accept the classroom atmosphere, or rather are uncomfortable or not anywhere. They are not able to adjust to a perfect classroom atmosphere. Now, the strategies that can be used or the strategies followed while dealing with ADHD is seen as follows. that it is best managed through a combination of behavioral and pharmacological measures. They seek support of teachers, doctors, school counselors, and learning specialists to assist these children. Keep channels of communication open, use of preferential seating, fidgets, cueing, breaks, timers, pair auditory, writing, text, scribe. Now, further methods or therapies that can be followed are occupational therapy. Now, occupational therapy is the use of assessment and intervention to develop, recover, or maintain the meaningful activities or occupations of individuals, groups, or communities. It is an allied health profession performed by occupational therapists and occupational therapy assistants. OTs often work with people with mental health problems, disabilities, injuries, or impairments. They provide support for these people who are having problems, as mentioned earlier, and this can actually help them in their attention span and arousal level, sensory and processing skills, fine and gross motor skills, activities of daily living, also known as self-help skills such as brushing teeth, visual perceptual skills, and so on. Now, here you may find these are some of the occupational therapies followed in schools, where children are trained to the following activities. That is, when they are, for instance, stringing beads, tying laces, attaching the button into the holes, or throwing objects through rings, reading and writing using the clap and tap method, right side reading technique, and these various techniques which can also help in your mathematics skills as well. So, as we have discussed about the various learning difficulties which we experience while teaching children, once we are aware of the fact that they have these difficulties, the next step would be to assess them and find out the intensity, and then use the tools and methods to help them to overcome it to a certain extent, though they cannot be completely eliminated, but they can probably function more or less in a moderate manner. Now, for the types of assessments, informal assessment, and there is the formal psycho-educational assessment as well. Now, learning disabilities, testing for learning disabilities usually involves three primary types of assessment. They are as follows: testing of intellectual or cognitive potential, testing of information processing or sensory motor abilities that are indicative of a learning disability, assessment of current educational achievement. In the informal assessment method, such as classroom assessments, then there could be systematic observation, a file review and interviews. These are as important as administering formal instruments to determine levels of academic skill. For developmental identity of strengths and weaknesses in learning processes. Because it is so important to intervene as early as possible, teachers should not wait for formal assessment to occur before they put strategies in place. Because if the child is diagnosed at an early stage, it is in their best interest to start working on it and to help them rather than wait for the informal assessment formality. Assessment to identify a learning disability should integrate information from a number of sources, including the family, that is knowing the family history, teachers, counselors if they are involved in the process, learning assistants or other records, and any relevant medical reports if there is such a and any relevant medical reports if so. Once a student has been referred for a formal assessment, a teacher or principal will need to obtain parents' permission and assist the student and their parents in understanding what will occur during the formal assessment process. Now, in the formal assessment, it is usually done by psychologists. It involves the usage of different instruments or tools. Psychoeducational assessments reveal difficulties in the areas of perceptual and information processing, language and auditory processing, attention in other areas of executive function, motor abilities or social skills, as well as reading, written language or mathematics. Now, to be specific, there are a number of tests which are used for dyslexic people. Now, of them, if you can just look at the chart, we can see that these tests are generally expressive one-word picture vocabulary tests. There are clinical evaluation of language fundamentals, receptive one-word pictures, and so on. Now, tests for dysgraphia, on the other hand, we have the ray or stereotype, complex figure drawing, and the like. Tests for dyscalculia, there are subtests of Woodcock-Johnson pseudo-educational battery, wide range of achievement tests, key math diagnostic assessments, and so on. As for now, assessment for reading, we have a number of methods of doing the assessment for the reading skill. Identification of alphabets and knowing the sounds of letters in the early years. The word in isolation, and that is analysis of the kind of difficulties present while reading a word, including decoding strategies. These could include substitution, omission, or addition of consonants or vowels. Reading for meaning from a sentence or passage. Fluency in reading, that is the child's reading the text in a word by word, phrase by phrase manner, which pauses that do not contribute to the meaning of the text. Does the child ignore punctuation while reading? Understanding written directions. Middle school and high school students should be assessed for reading rate. So these are the specific things that has to be noted from a very early age so as to correctly assess the disability or learning difficulty in children. Assessment of writing, there is importance is given to there. Now, regarding assessment of writing, proper check is made to see whether the child holds the pencil properly, his grip is proper, or helps him to improve his pencil grip. Ability to retrieve alphabets, repressing sounds, the formation and legibility of letters or numbers, and the following methods that are mentioned can be used for assessing the writing. Now, for the assessment of mathematical skills, if we look at the chart, we can see that the ability to recall basic math facts, procedures, rules, or formulas, ability to maintain precision during mathematical work, ability to sequence and carry out successfully, and the like, can throw light on the actual advancement or progress, or to know whether the child is actually benefiting by the help that is being given. Now further, technology is also used in the following ways to assist the child in the assessment process. The other assistive technology that can be used are as follows. So in today's session, I have tried to put forward in my best possible means, that is, what are the basic processes of learning, how people learn, what are the factors that affect learning, what are the different methods of learning, and what are the probable factors which can affect learning, and the learning disabilities or difficulties that people or children face, which, if actually diagnosed at the appropriate time, that is as early as possible, and proper intervention is done, can actually help that individual to function as a better and a more stable human being. So in short, I will just give a gist of the entire presentation. Now, specific learning difficulties can be defined as a heterogeneous group of conditions wherein there is a deficit in processing language, spoken, written, that may manifest itself as a difficulty to comprehend, speak, read, write, spell, or to do mathematical calculations, and includes such conditions as perceptual disabilities, dyslexia, dysgraphia, dyscalculia, dyspraxia, and developmental aphasia. Now, remediation is preparing an individualized education plan for each child according to his or her functional level, which will help to overcome weakness in a particular area. We have seen that early identification by clinical psychologists and educators or counselors is what has to be done so as to identify a learning challenge, disability, or developmental delay as early as it can be seen, maybe from the time the individual is an infant, then a toddler, and probably a preschooler. And it is also observed and a well-known fact that early intervention, which is a process of assessment and therapy provided to children, especially those younger than age 6, to facilitate normal cognitive and emotional development and to prevent developmental disability or delay. Now, how can we help children with specific learning disability? Now, one thing that has to be noted is that a specific learning difficulty is not the case as in a child who has intellectual disabilities, visual or hearing impairments, mental disorders such as depression, anxiety, and so on, or neurological conditions or disorders. Causes of specific learning disability can be summarized as learning disabilities which are not caused by economic disadvantages, environmental factors, or cultural differences. There are also known medical treatments, and there are no medical treatments for learning disability as such. Now, types of learning difficulties can be again shortlisted as dyslexia, dysgraphia, dyscalculia, dyspraxia, and developmental aphasia, difficulties in expressive and receptive language. Now, where can we see an specific learning difficulty? Where can we actually see? Well, learning disability or difficulty transcends geographic boundaries and populations, and they exist in almost any community around the globe. Now, the summary of the entire day would be: every child has a unique profile of strengths and weaknesses depending on the learning disorder and or combination of learning disorders. There are many strategies to assist each student in finding success in school and life. Now, what we can do is contact your school to request an evaluation if you suspect your child has a learning disorder. And communication between parents and school personnel and outside practitioners is also equally essential. Thank you so much. Thank you.